Lab 1 Blood Pressure by John Paul De La Rosa. Make sure 5 minutes have passed before taking the first blood pressure. After the first one is done, wait 1 minute before you take the second blood pressure. Refrain from caffeine and nicotine before taking the blood pressure. Make sure the arm is bare. The body is upright with back support and the feet are placed flat on the floor. Arm is supported at heart level. Make sure the prongs are in the right direction, which is forward. Make sure it is open and that you can hear inside the stethoscope. Make sure you use the proper cuff size to ensure you have accurate measurements. Depending on the arm size will determine the cuff size. Adults require large cuff size. You want to make sure the cuff is firmly in place above the brachial artery on the upper arm. Check to make sure it is on firmly. Make sure the valve is closed and start pumping the air. When taking blood pressure, the first Korotkov sound will be a tapping sound that will be the systolic blood pressure. The last Korotkov sound will be silent and that will be the diastolic blood pressure. Make sure the diaphragm is under the cuff and above the brachial artery. On the subject that you do not know the blood pressure, inflate the cuff pressure to 200 millimeters mercury. If you know the subject's blood pressure, go 20 millimeters of mercury above the blood pressure that you know. When releasing the blood pressure, release it at a rate of 2 to 5 millimeters of mercury per second. You should take at least 2 blood pressure measurements and should take the average of both. Values for blood pressure. Normal blood pressure systolic is less than 120 beats per minute and diastolic is less than 80 beats per minute. Pre-hypertension blood pressure systolic is between 120 to 139 beats per minute and diastolic is between 80 to 89 beats per minute. Stage 1 hypertension blood pressure systolic is between 140 to 159 beats per minute and diastolic is between 90 to 99 beats per minute. Stage 2 hypertension blood pressure systolic is greater than or equal to 160 beats per minute and diastolic is greater or equal to 100 beats per minute. References: